What do you do when your back pain is not responding to the drugs, cortisone therapy, and chiropractic care? Well, many people are now turning to the internet and searching terms such as stem cell therapy, umbilical cord stem cells, human cellular tissue products, and Wharton's jelly, looking for proven, effective, long-term solutions. During the next 7 minutes, I'm going to explain what these products can do, what you can reasonably expect from them, and some of the hype that you should probably be aware of so that you can become better informed when it comes to options that are proven to be long-term relief for your chronic back pain. Hi, I'm Dr. Roy Picard, DC, and since 2017, the medical team here at Michigan Integrative Health has been offering regenerative medicine products. We have a lot of people reach out asking us about stem cell therapy, umbilical cord stem cells, human cellular tissue products, and Wharton's jelly. Now, many people want to know if and how these products can be helpful for their chronic back pain. Most of the people who come to us are already suffering with chronic back pain, and they've been diagnosed with such conditions as bulging or herniated discs, sprains and strains of the muscles in the back, foraminal stenosis, canal stenosis, arthritis, degenerative joint disease, degenerative disc disease, and bone on bone, and they want to know if these products can be helpful. One of the reasons that there is so much interest in these regenerative products we offer is because more and more people are interested in resolving their chronic back pain without the risks associated with drugs, like the whole opioid drug addiction and overdose problem going on in our country, as well as the concerns with surgery and the scary statistics regarding failed back surgery syndrome, which is something that you are starting to hear more and more about. So what is so special about these products? It's real simple. They contain substances that are proven to heal damaged tissues in your body. They contain substances like cytokines, growth factors, proteins, mesenchymal stem cells, exosomes, microvesicles, and much more. Again, all of these substances work together to heal damaged tissues in the back. And also understand that these products not only initiate the repairs, they also stimulate your own immune system to send the available substances that your body normally produces to the areas being treated in order for your own body to participate in the healing process. Now let's be clear, this is not going to give you a brand new back like you had when you were 18 years old. This type of product is not the fountain of youth or anything crazy like that. As you can imagine, there are some people making some crazy, unjustified claims when it comes to regenerative medicine and some of the products that are used. Just remember that these products are all about repairing the damage to the different tissues in your back. After all, can you name even one drug that can do that? Let's talk about these different terms that are often searched. Stem cell therapy is associated with stem cells that are harvested. Now, primarily these are coming from areas such as in the bone marrow. And this is often done as a type of surgical procedure involving your pelvic bone. The process involves using a specially designed, it's a pretty thick needle that can be driven through the bone. When you've talked to a number of people that have gone through this process, most people are going to tell you that it was quite painful. So many people are thinking twice when it comes to this procedure, not only as a result of the potential pain, but there's also some question in regards to the quality of stem cells that your particular body is currently producing. Now we know that it's proven that the older we get, the less effective our stem cells tend to be. Another group of terms to discuss are the umbilical cord products, the human umbilical cord tissue products, and Wharton's jelly. Now, as opposed to the bone marrow aspiration, these products come from women here in the US who donate their umbilical cords in an ethical manner after electing to have a C-section. It has to be a full-term birth of a healthy live birth, okay? So in order for these women to become eligible to donate their umbilical cords, both the mother and child are tested and must pass rigorous guidelines set up by the FDA, the National Institutes of Health, the American Association of Tissue Banks, and the American Association of Blood Banks. These umbilical cords can then be purchased and processed by private labs in order to provide products that do not contain red blood cells and are immune system neutral, and therefore these can be used by just about anyone who is suffering with chronic back pain, as well as other chronic joint pains of the body, including the knee, hip, and shoulder. With these particular products, you are able to avoid the painful bone marrow extraction, and you are getting a product which is, for, let's say, lack of better terminology, coming from a much younger source than your own body, with fresh cells and other healing substances. There is no need to go through a process of matching donors, since it doesn't even contain any red blood cells. Wharton's jelly is a term that is used to describe the specific part of the umbilical cord tissue. It's the highest concentration source of mesenchymal stem cells. This is the reason that umbilical cord tissue or human cellular tissue-based products are so desirable and effective. Science also proves that these products are effective not only because they contain the mesenchymal stem cells, but also the cytokines, growth factors, proteins, exosomes, and microvesicles to heal the damaged tissue in your back. So now you probably realize that these products and services are not the same care that you're going to get from your family or primary care doctor, the specialist, the physical therapist, or the chiropractor. People travel to Michigan Integrative Health from all parts of the state, including the Upper Peninsula, down to the Ohio border, and as far west as Grand Rapids and Kalamazoo. We've seen people from northern Ohio, from cities like Cleveland, Oregon, Bowling Green, Perrysburg, and Toledo. And there's many people that drive from Ontario, Canada, coming from Toronto, Hamilton, Kitchener, London, Sarnia, and Windsor. We do not use any medications or offer any surgery. So when you're dealing with chronic back pain, you owe it to yourself, you owe it to your family and friends to look at all of your options, whether your back pain is a result of a bulging or herniated disc, sprain or strain of the muscles in the back, foraminal stenosis, canal stenosis, arthritis, degenerative joint disease, degenerative disc disease, or bone on bone. Be sure and take the necessary time to learn more about stem cell therapy, human umbilical cord stem cells, Wharton's jelly, so that you are fully informed of the options above and beyond the drugs and surgery associated with traditional medicine. If you need more questions answered, if you need to take it to the next level, then give us a call. We can offer you a complimentary phone consultation for you to ask any questions. We want you to be informed, and then, and only then, if umbilical cord stem cells and human umbilical cord tissue-based products sounds like they might be right for you, then we can talk about scheduling an in-office consultation, exam, x-rays, and assessment to prove whether or not you would be a good candidate for the type of care we offer.